Let's talk about how to recognize and treat bone, muscle, and joint injuries. Musculoskeletal injuries can be anywhere from quite minor to very severe. We want to have some tools to assess and treat them because they happen pretty frequently when people are active, and undertreating or overtreating can have long-term consequences. If the injury is obviously very serious, skip these assessment steps and just call 911. Keep your treatment to a minimum to avoid making it worse. Examples of serious injuries needing a 911 call include excruciating pain, inability to move, gross angulation, or the bone is protruding from the skin. Assessment is only necessary if you're not sure whether the person should see a doctor at all, or to help decide if the person can be safely driven to the hospital or should go by ambulance. First, look. Once the person is in the most comfortable position possible, have a good look at the injury. If the injury is on a limb, compare the injured side to the uninjured side to get a better idea of what it should look like. If there's very serious discoloration or any obvious swelling, the person should see a doctor. Then feel. Use your thumbs to palpate the injury site. Be gentle and of course careful, but apply reasonably firm pressure. Minor injuries will usually be more painful when moved, not when touched. If there's any sudden sharp pain in a specific spot, the person should see a doctor. For more serious injuries on a limb, you should check for feeling at the furthest point on the injured limb, so the fingers or the toes. If a person can't feel at the extremity or it's gone cold from lack of circulation, you should call 911. Now move.
Okay, can you wiggle your toes? I don't remember.
Only do this step if both looking and feeling didn't reveal any problems. If the injury is serious, this step could make it worse. Slowly and carefully have the person move the injured part in each direction. Stop when it begins to hurt. If the injury is on a limb, compare this to the range of motion on their other side. If there's a noticeable difference, they should see a doctor. If someone should see a doctor and the injury is relatively minor or moderate, they can often be safely driven to a walk-in clinic or hospital. Treat it and support the injury as best you can before they go in order to prevent injury in the transportation process. More serious injuries will require an ambulance. If you can't get them to the doctor without making the injury worse, call for professional transportation. This most commonly applies to lower body injuries, but of course can also apply to the back and upper body too. Even if it may not seem that bad, but the person can't walk on their own, we should call for help. Ambulances aren't just there for life-threatening emergencies. Sometimes they're just needed because they have specialized equipment and training to take someone to the hospital in a way that prevents further injury. To treat a musculoskeletal injury, we'll use the acronym RICE. R is for rest. Start with getting the person into as comfortable a position as possible. When someone's in a lot of pain, this can be difficult to achieve, but be patient and encourage them into a good, safe position. If the injury is more serious, we should also treat the person for shock and use a blanket to keep them warm. I is for immobilize. This step is often quite a bit easier than getting them settled into a resting position. Most people who have hurt themselves will naturally try to support their own injury in the least painful position. Let them. For people with more serious injuries, we should stick to passive immobilization. We can give them a soft blanket, jacket, or pillow to tuck around the injury, or we can do it for them if they can't support it on their own. Mainly, we want to leave very serious injuries alone and be very careful not to make it worse by trying to support it. If we've fully assessed an injury and proven that it's minor, then that's just about the only time where we would use more active measures to immobilize an injury, like a splint or sling. C is for cold. Applying cold to minor or moderate injuries shortly after they happen can reduce swelling and can help them manage the pain. Don't put anything too cold right against the person's skin. It's better to wrap cold packs with a towel and then have the person remove it for a few minutes if it feels uncomfortably cold. It's also important that we do not apply cold to very serious injuries. Bones that are severely broken or dislocated can interrupt circulation to a limb. Adding cold can make it even worse. E is for elevate. Only elevate injuries if it's comfortable to do so. Elevating minor injuries can reduce pressure and the associated pain and throbbing that comes with it. But if elevation is going to disrupt the injury, especially a more serious one, it can do more harm than good. For something like a sprained or broken finger, We could stabilize the finger first with some soft material and a gentle wrap. Once the injury is stabilized, we might help them to elevate their whole forearm with a sling without having to disturb the injured finger itself.